Now with our GMA cover story, a new personalized cancer vaccine is showing promise in a trial to treat melanoma, an aggressive kind of skin cancer. The treatment significantly delayed the cancer from returning and stopped it from spreading in high-risk patients. Dr. Michael Postow, Chief of Melanoma Service at Memorial Sloan Kettering Cancer Center, is here with us to break it all down. Doctor, it's so great to see you. It's such a fascinating study. Tell us about it and what we've learned from this and how the vaccine actually works.
This is a huge advance for patients with melanoma and also for hopefully all of medical science. This vaccine works by when a patient has a tumor surgically removed, melanoma in this instance. In the laboratory, we can study those tumors and see what's different about this tumor from all of the other cells in a patient. And then a vaccine is made such that when that vaccine is administered to the patients, in combination with a drug called Keytruda, it teaches the body's immune system to go and protect that body and fight against anything that looks like this kind of cancer in the body. And it's been shown to reduce the risk of melanoma coming back after that surgery.
So it delays the risk of cancer, the cancer returning. But one of the big questions is, does it prolong life expectancy? Do we know yet?
We don't know yet. That's one of the big questions from this trial, is that we don't know whether the overall survival of patients is increased with this type of an approach. But by showing that this reduces the risk of melanoma coming back and melanoma spreading to other parts in the body, that in and of itself is a huge advance. And we're hoping with longer-term follow-up, the overall survival will also be improved, but we don't know that just quite yet.
Am I right in hearing you when you say that this is sort of like a personalized vaccine?
Absolutely. That's the coolest part about all of this, that this is personalized. So one vaccine for one patient based upon their tumor. One vaccine wouldn't work for a different patient, and that's part of this where the science is really, really interesting, that we know exactly what it is about one individual patient's tumor that makes it unique, and a vaccine can be created just for that patient.
So it potentially opens it up to other cancers as well, right?
Exactly. This principle has been demonstrated in melanoma first, but there's really no reason that this should only be considered a melanoma treatment. Clinical trials are ongoing all around the world and at our institution, MSK, where we're testing these types of vaccine approaches in patients with lung cancer, bladder cancer, kidney cancer. And our hope is that what we've learned in melanoma will be relevant for patients with all different types of tumors that are removed surgically.
Yeah, so much hope with this. We don't have much time left, but can you just give us a sense of the next steps here?
We need more data from this trial, so in the coming months we'll find more details out about how good this improvement really was in this clinical trial. And then I think the next step will be seeing how effective it is in patients with other kinds of cancers, and then how do we optimize it? How do we combine it with other drugs to further increase the efficacy?
Wow, really, really interesting. Dr. Postow, thank you so much for taking the time. We appreciate it.